Action for your health tonight. Just this week, we saw the price of a life-saving pill jump from less than $8 a pill to hundreds of dollars. It shed light on an issue affecting so many people, the financial strain medical bills often bring. ABC Action News reporter Ashley Yore helps explain how a devastating diagnosis can drain your bank account.
This hospital room is familiar territory for Hunter Swain.
It started 3 years ago. I was diagnosed with a different strain of leukemia.
Months of her 13-year life, she's been here, pencil in hand, battling 2 types of cancer, overcoming blood clots attached to tubes.
And they were all connected to an IV pump, and I had around 11 different medicines going at the same time.
Each of those medications with an expensive price tag.
The financial part never crossed my mind until I received that first bill.
Gary's paying for regular life expenses along with medical bills.
Then you're flooded with like, oh boy, you know, I might have to pay 20% of this. It's going to take years and years and years and years and years to try to pay this off.
And many experts say this cost of cancer treatment is a scary reality, including one of Hunter's doctors, Dr. Gregory Hale.
And really their whole life is already consumed with their child's medical care. And then when you add the stress of the finances of the family on top of that, it can almost become unbearable for families.
Dr. Hale says chemotherapy drugs can be given different ways, and that could affect how much you pay for them. Historically, intravenous drugs would be covered.
Many of the newer targeted therapies are actually oral. It can be taken as pills or liquids. Those, however, typically require a higher copay.
The new meds can be more efficient, but pricey.
And when some of these new medications can cost $10,000 a month, then 20% of $10,000 is a substantial amount, particularly when that therapy can go on for several years.
Some patients avoid treatment if they know they can't afford it.
Good example is the head and neck patients who will come in with just very large cancers rather than going to see their doctor as soon as they have a sore throat. They'll come in here when they can't swallow anymore.
The medical director of radiation oncology at Tampa General Hospital says the biggest problem he sees is the difference between how much the drug costs to make and the price tag of the treatment.
I think there's going to have to be some sort of rationalization, some sort of coming to grips with it. You can't charge an infinite amount of money when people are desperate for survival.
Drug companies would argue they often spend more than a decade and over $1 billion to develop each of these cancer drugs. Social workers do help families find some coverage for the piece they'll owe. As they wait for Hunter's bone marrow transplant, the Swains need any financial assistance available.
Her bills overall have been well over $1 million. And no, I could not imagine having to pay the whole $1 million. I mean, there's no way.
I just know everything's going to be okay. It's just a feeling.
Doctors say the best thing you can do if you or a family member is diagnosed with cancer is to talk to your healthcare team about your finances up front. They say there may be more than one way to treat the disease, and they could each be covered differently with your insurance plan. I'm Ashley Yore, ABC Action News.